everybody. So today our topic is gonna be hypertension. So the measurement of the blood pushing against the blood vessel walls, that pressure is known as the blood pressure, and it is defined by systolic by diastolic blood pressure, also known as SPP or upon DBP. And the normal range for it is going to be less than or equals to 120 by 80. It is measured in the unit of mmHg. The blood pressure have affected billions of peoples all over the globe. Some studies have observed that the age on which disease occurs and its outcomes are in result of chronic diseases like diabetes and obesity. Hypertension is commonly occurring in children and adolescents, which can increase the risk of CVD, that is cardiovascular diseases, in their adulthood. Some factors which have caused hypertension during childhood are family history, obesity, physical activity. Elevated blood pressure is highly associated with higher risk of sudden cardiac death, which is also known as SCD. It is the largest single contributor all over the globe, accounting stroke, coronary heart disease cases, and 9.4 billion deaths per year. Modification in diet have been highly recommended as a lifestyle modification strategy for preventing the hypertension. And also it is less costly as compared to the pharmacologically treatment. Dietary strategies for reducing blood pressure is dietary approaches to stop hypertension, which is also commonly known as DASH diet, and Mediterranean diet patterns are followed as well. Evaluating and monitoring blood pressure have also upgraded with traditional ways with the help of technology, which includes cuffless blood pressure sensors, wireless smartphone applications, and many more. So now age of hypertension onset. So blood pressure level increases with age and can result in cardiovascular diseases. Young people who are hyperintensive and are undiagnosed with blood pressure have higher risk from suffering from CVD. Some studies have shown that some chronic diseases like diabetes and obesity are also related to age. There are three methods which are used to get information on blood pressure levels on an individual, which are serial BP measurements, medical records, or self-report. Many methods are used in many different studies, and it is said that early onset hypertension have a strong genetic component and is related with severe cardiovascular diseases as compared to late onset hypertension. So the next topic is going to be blood pressure in childhood and adolescent. Factors which increases the risk of hypertension in children are obesity, family history, improper salt intake, sleeping habits, and many more factors are leading to the increasing hypertension amongst children and adolescents. The diagnosis and treating pediatric hypertension have severe challenges for clinicians. One of the important is how to manage children and adolescents having hypertension. It is seen that there are many reasons like lifestyle behavior, environmental, and genetical factors which can develop hypertension amongst children and adolescents. Some of the reasons like perinatal history, family history of hypertension, physical inactivity are like the adult's ambulatory BP monitoring, which is also known as ABPM, is a device that measures BP automatically every 15 to 13 minutes, in suggested by the 2017 AAP, which is American Academic of Pediatrics guideline. Along with this, it also suggests that if children and adolescents who are not successful in reducing blood pressure levels with the lifestyle changes, then pharmacological treatments with hypertensive medications are required for them to get back to normal. The next step is dietary approaches. So as we all know that diet plays an important role in treating a particular disease. Diet modification is the best strategy for preventing hypertension, and as said, it is less costly as compared to pharmacological interventions. DASH diet, which is dietary approaches to stop hypertension, or Mediterranean diet is suggested for the patient suffering from hypertension. DASH diet is basically rich in fruits, vegetables, and dairy products, which have low fat and reduced saturated and total fat. It has been tested for controlling trials in specific population, including obese, hypertensive, and the people who have type 2 diabetes. The Mediterranean diet is similar to the DASH diet, but is higher in fat, mainly monosaccharides, fat from olive oil, nuts, and seeds. Talking about macronutrients in DASH diet, so let's go with protein first. So a variety of studies, both observational and randomized controlled trials, have demonstrated that protein supplements or the replacement of protein from fat or carbohydrate is an caloric diet results in the lower blood pressure. In a study, trial was done amongst 352 adults with pre-hypertension, where they were assigned to consume 40 grams per day of soy protein, and milk protein supplements for 8 weeks in random order. Soy protein and milk protein supplements reduce systolic blood pressure by 2.0 mmHg and 2.3 mmHg respectively. Diastolic blood pressure was also reduced but not statistically significantly, and no difference was observed in reduction according to type of protein supplements. The exact mechanism relating dietary protein intake to blood pressure remains unclear. Increases in dietary protein intake may impact plasma amino acid concentration, which in turn may affect blood pressure regulation. The next micronutrient we take is going to be fat. Dietary fat have also been a focus of investigation in the area of hypertension and blood pressure. Total dietary fat intake includes intake of saturated omega-3 polyunsaccharides, omega-3 polyunsaturated, omega-6 polyunsaturated, and monounsaturated fatty acids. There have been great interest in the possible effect of monosaccharide fats and omega-3 polyunsaturated fatty acids in regulating blood pressure. The evidence of the effect of omega-3 fatty fats from the fish oils on the blood pressure is also generally consistent, with at least 5 meta-analyses finding statistically significantly reduction in blood pressure. The most recent of this analysis focused exclusively on fish oil supplements and included 17 randomized controlled trials with a total of 1524 participants.